Good evening, I'm Answana Esonyasi, and this is QTV News coming to you live from our studios on Caraba Avenue. Thanks for joining us. Here are the main news headlines. The Presidential Meet the People tour has wrapped up on Monday in Banjul, where the President renewed his commitment to bring more development projects to transform the Gambia. The program manager at the National Malaria Control Program has revealed that malaria prevalence in the Gambia is 0.1%. The United Nations Industrial Development Organization, UNIDO, has handed over a multi-million-dollar fish smoking house to the women fish smokers at the Brufut and Tanje fish landing sites. And on Monday, the Gambia joined the rest of the world to commemorate Universal Health Coverage Day to raise awareness of what is required to deliver essential health care. In international news, ECOWAS parliamentarians have strongly condemned the abuse of a female parliamentarian in Senegal's parliament, seen in a widely circulated video. Well, stay tuned as we bring you more on these and other stories. Those were our main headlines, and now we take a look at the news in detail. The Presidential Meet the People tour wrapped up on Monday in Banjul, where the President renewed his commitment to bring more development projects to transform the Gambia. Residents of the capital complimented government for its infrastructure projects in the city and demanded more development. Our colleague Maud Lamin Choi tells us more.
The Gambia's capital, Banjul, is the last meeting venue for the Presidential Meet the People tour. Residents of the constituencies of Banjul North, Central and South congregate to welcome the President for a dialogue on matters affecting their lives and livelihoods. The dialogue with Banjulians highlights people's gratitude to the President's development record and issues in need of addressing to improve their living condition. The first to open the dialogue is the Deputy Mayor of Banjul, Omar Toure, on behalf of the Banjul City Council. The Deputy Mayor points out that through government's response and collaboration of the Banjul City Council, there was a solution to this year's rainy season flood. Deputy Mayor Toure reiterates the need for central government to collaborate with and support the council and not to be divided by politics for the development of the country. Aziz Dabah Gay, a Banjul councillor, outlines government's rehabilitation project in Banjul, including development of primary and secondary roads, which has smoothened and complemented the council's mandate and efforts. Councillor Gay also complains about the proliferation of warehouses in Banjul, which, according to him, has made access to and the cost of housing more difficult in the city. He calls for government's intervention to define zones for residential and commercial use to create more space for housing. The Banjul councillor also appeals the government to establish a low-income housing scheme for the less privileged. Mbai Gay, a Banjul elder, informs the President of the lack of vehicle for police patrols to tackle crime in the capital. Mr. Gay also wants government to help rehabilitate the youth center in Banjul to host events for the Banjul youth. The Minister of Energy and Petroleum, Abdou Job, informs the Banjul residents that there are government projects that will increase and improve access to water and lighting in all parts of the capital. The Minister of Lands, Sharif Abbas Sanyang, responds to some of the concerns raised, some of which fall under his area of responsibility. Regarding the warehouses in Banjul, the Lands Minister says that his ministry is working to define zones in the capital. According to Minister Sanyang, government plans to devise a housing scheme for low-income earners to rent or buy affordably. President Adama Barrow takes to the podium for his last address to Gambians on the 2022 Meet the People tour. The President recounts his memories of living in Banjul, where he spent time and attended high school, noting that the capital impacted his life. The head of state references his election victory in Banjul, which he said is a manifestation that he commands strong support in the capital, and assures the crowd that his government will continue to address the development needs of the capital. About the Banjul rehabilitation project, the President reports that work is more than 90% complete and that the city's residents should brace themselves for a grand inauguration. President Barrow pledges that his government has more projects on the way for the capital and stresses that his mandate is a social contract which he will use to deliver more development in accordance with the needs and aspirations of Gambians. Mahmoud Lamin Chai, QTV News.
And now to some health news. The program manager at the National Malaria Control Program has revealed that malaria prevalence in the Gambia is 0.1%. Balakande disclosed this during an interview with QTV about the malaria situation in the country. Umi Awaba has the rest of that story.
Malaria, although preventable and curable, is a life-threatening disease caused by parasites transmitted to people through the bites of infected female Anopheles mosquitoes. In 2021, the WHO African region was home to 95% of malaria cases and 96% of malaria deaths. Children under 5 accounted for about 80% of all malaria deaths in the region, and the Gambia has not been spared. Balakande, the program manager for National Malaria Control Program in the Gambia, speaks about malaria situation in the country.
Malaria has gone down significantly over the years, including this year. However, talking about this year, obviously, you know, we are in the peak of the malaria season. So when the malaria season picks up, like it reaches the level that normally malaria increases, so people normally interpret it as increased number of malaria cases. But that does not necessarily mean that the cases have gone beyond expectation. And malaria control, malaria as we speak now, the prevalence of malaria is 0.1%. So we have reduced malaria very, very significantly, you know, to a level that we feel at least we can now comfortably say we have reached elimination.
In August this year, a report emerged that mosquitoes from Asia were linked to a malaria outbreak in Ethiopia, in Eastern Africa. Is Gambia under threat from this invasive mosquito species?
I can say not yet. But you know, if cases are discovered or if there is an outbreak within the African continent, obviously there are chances that cases can also reach the Gambia. But for now, the Gambia is not affected because this Anopheles staphylococcus is a type of vector that transmits malaria, you know, especially in the eastern, in the Southeast Asia, but now it has reached Ethiopia. But we are very alert, and we've started our monitoring on our vectors to ensure and to also verify some of the vectors that are available. But we've been doing it over the years with MRC and other partners.
In September this year, a new vaccine for malaria developed by scientists at the University of Oxford was up to 80% effective at preventing disease in young children. Mr. Kande says the Gambia is on course to secure the vaccines.
This study was done in Ghana and Malawi, you understand? But now African countries have been given the opportunity to apply. We've started applying, we've started writing the proposals so that we can also get the vaccine. So hopefully, by next year, hopefully, you know, when the proposal is accepted, we will also get the vaccine in the Gambia.
Complete eradication of malaria will need more resources and collaboration. As of 2022, only 2 African countries, Algeria and Morocco, have been designated as malaria-free after 3 years of 0 cases. Gambia's near neighbor, Cape Verde, has registered 2 years of no case. Mr. Kande highlights some of the challenges the NMCP faces as an organization.
Resources are never adequate. So resources is a challenge because what we are getting from the Global Fund is not enough to cover the entire country. If we had more resources, we'll be able to really reach the last mile of malaria control, but resources is a major challenge.
Mr. Kande thanked the Ministry of Health, Global Fund, the Medical Research Council, WHO, and all other partners for their support. Following the distribution of nearly 1.5 million bed nets across the country, Mr. Kande advised the public to sleep under mosquito nets to prevent malaria. QTV News, Umi Awaba.
Now, the United Nations Industrial Development Organization, UNIDO, handed over a multi-million-dollar fish smoking house on Friday to the women fish smokers at the Brufut and Tanje fish landing sites. Usman Jidabo witnessed the handing over and filed this report.
The event was attended by community members in Brufut and Tanje and women involved in the fishing industry. The project seeks to help improve the environment and working conditions to ease some of the challenges faced by women fish smokers in these communities. The project complementing the efforts of the Ministry of Fisheries in providing modern techniques to help protect the fisheries sector and prevent environmental hazards. Mustafa Sise, the Food and Agriculture Organization Assistant Country Representative, explains the importance of these smokehouses.
These ovens, the FTTs, they help in reducing smoke inhalation among women. So this makes them very healthy for the women users. They are hygienic, and they are economic in their use of fuel wood. The use of fuel wood, like the director rightly said, is really creating a problem with our natural resources. There has been reports of extensive logging for firewood creation, especially in the mangroves, and this is having a negative effect on the environment. And as we talk about climate change, these are the issues that need to be addressed.
Omar S.M. Jiba, the Permanent Secretary, Ministry of Fisheries, says his ministry will always partner with FAO in improving the lives of Gambians, especially women working in the fisheries sector.
What we are into is benefiting the Gambian people, especially the women, and is towards promoting self-food sufficiency and, most importantly, the good health of the women.
Speaking on behalf of the beneficiaries, Bibi Mane, President of Women Fish Smokers in Brufut, and Fatmata Conte, Women Leader for Tanje Fish Smokers, both thanked the FAO and the Ministry of Fisheries for the project.
Before the construction of this new smoking house, after closing from work, we board vehicle while putting on our dirty clothes with bad odor. Other passengers will even complain about our condition because they would not want to get the bad smell from us. But that is a thing of the past now. Because of your remarkable support, we are happy and we thank you for such good gestures. We thank God for the facility that you have brought to us. We can now smoke our fish and keep them in a safe place, where they will be preserved compared to those days when we used broken down structures and outdated equipment to smoke fish, which end up spoiled, or sometimes thieves will come and steal all the fish from the stores. We really appreciate your support and thank you so much.
This intervention by Food and Agriculture Organization, with the support from UNIDO, is to help the beneficiaries prepare and preserve fish in a healthy and safe environment, and also mitigate the effects of climate change with modern fish smoking equipment and techniques. For QTV News, Usman G. Dabo.
And the report there by Usman G. Dabo will lead us to the commercial break, but we'll be right back.
Bank from here and there and here too. Here and even here. Introducing the Bloom Digital Suite from Bloom Bank Africa. Web and mobile banking that allows you to bank on the go at your convenience and on your own terms. Check and transfer funds, pay NAWIC bills, buy cash power, buy mobile credit, and so much more. For more information, visit www.bloombankafrica.com or pass by any of our branches nationwide. Download from the Apple Store and the Google Play Store. Bloom Digital Web and Mobile Banking on the go from Bloom Bank Africa.
Inco Home Choice ya kenun neserung adiate la kiliano le ninang fanay nata kotenke aning 10% discount hade 10% discount si inco la bagaso bagasang Gambia Banko kanjang na dinkral beto kabo December karo tilifolo kata fo December fadula ye construction bagaso sotalienne generator welding tools aluminium tools carpentry tools water pumps electrical tools plumbing tools safety equipment kata fo pususol washing machines aning garden tools ñin bagage jama albe solo la menna pour kado ko kala watali bari kata bakalita Inco Home Choice jibe ibale Jimpex wala liye ko man ñin nombato 7398863 wala birkama 3039300 wala Senegambia 3296967 wala fani sukota ñin nombato 3417619 Inco Home Choice ñul na tele pour ka jamano dahandi.
Welcome back. You're watching QTV News and we're broadcasting live from our studios on Kairaba Avenue. I am Ansmane Sonyasi. Now, on Monday, for the first time, the Gambia joined the rest of the world to commemorate Universal Health Coverage Day, to celebrate progress and raise awareness for what is required to deliver essential health care for families and communities everywhere. Julden Jai attended the event and Sina reports.
Organized by the Ministry of Health and partners, the event started with a march past from the Senegambia Junction to the Sadauda Kairaba Jawara Conference Center in Bijilo. Universal Health Coverage Day was proclaimed on the 12th of December 2017 by the United Nations. The day aims to raise awareness of the need for strong and resilient health systems and universal health coverage. This year's theme, Build the World We Want, a Healthy Future for All, emphasizes that to build strong health systems, we need equity, trust, healthy environments, investments, and accountability. Jibril Jaju, the Director of Planning at the Ministry of Health, stated that the wish for every country is to see how people have access to health services without financial hardships.
Improving health systems, coverage, and health outcomes depend on the availability, accessibility, and capacity of health and healthcare workers to deliver quality, people-centered integrated care. Investment are therefore needed for both public and private sector in health workers' education, as well as in the creation and filling of fund positions in the health sector.
Mr. Jaju added that the government is conscious of the high cost of accessing healthcare by households, which currently stands at 24.55%.
The country is almost approaching catastrophic health expenditure. It's unacceptable, and we appreciate the support of government for accepting the idea of introducing National Health Insurance Scheme.
Makawa C, the WHO Program Management Officer, speaking on behalf of the country rep, says this initiative signals the increased commitment of the country towards universal health coverage, adding that it makes it more special because it is happening in the wake of the launching of the health insurance scheme.
Gambia is making a steady progress toward universal health coverage. We all know that. However, a complete success requires more efforts and investment. Based on the 2019 estimate, the Universal Health Coverage Index is at 48.0, while medical care at public health facility is free or highly subsidized in the Gambia. Out of pocket for essential medicine and some diagnostic services has kept Gambia universal health coverage from advancing faster.
Mr. C added that WHO will continue to support the Gambia's ambition and progress towards universal health coverage.
We will continue to assist the Gambia in translating this policy into results that will save lives.
Universal health coverage includes the full spectrum of services needed through life, from health promotion, prevention, treatment, and rehabilitation, and is best based on a strong primary health care system. The event also featured a presentation on theoretical aspect of the health financing landscape in the Gambia, and participants were allowed to ask questions and make comments and recommendations on Gambia's healthcare delivery. For QTV News, I am Julden Jai.
And from that report there by Julden Jai, now on to international news in a moment. Now, ECOWAS parliamentarians have strongly condemned the abuse of a female parliamentarian in Senegal's parliament. In a widely circulated video, opposition MP Massata Samb was seen to have walked over, slapped, kicked and knocked to the ground Aminjai Jibi, a female parliamentarian of the ruling party. Aliou Cissé is covering the ECOWAS parliament session, and he now reports from Abuja.
The incident occurred amid growing rivalry between ruling and opposition party politicians. Aminjai Jibi of the ruling Benno Bokk Yakaar coalition was alleged to have insulted Massata Samb, a pro-opposition religious leader, during the budget presentation. In the declaration read out at the ongoing 2022 second ordinary session of the ECOWAS Parliament in Abuja, Nigeria, the Speaker of the ECOWAS Parliament, Dr. Sidi Mohamed Tunis, said the violence on the female parliamentarian is unacceptable and regrettable. He emphasized the importance of always respecting women. Speaker Tunis promised that the ECOWAS Parliament will take time during the ongoing session to investigate the issues surrounding the unfortunate incident.
One of the key goals of the 5th legislature of the ECOWAS Parliament is to strengthen women participation in politics. Therefore, the action as witnessed is very regrettable as it ends negative impressions against the gains made in the past few years. ECOWAS Parliament will continue to support and advocate for increased women participation and condemn any act of violence and abuse against women in general.
While wishing a speedy recovery to the victim, the ECOWAS Parliament urges the Senegalese state, in collaboration with the National Assembly of Senegal, to take the necessary steps to ensure that justice is done. The Parliament agreed to deploy a delegation to Dakar, Senegal, comprising Mouminatou Ibrahima, 3rd Deputy Speaker, Adjassatou Camara Pinto, 4th Deputy Speaker, and Fatoumata Ndiaye, a member of the ECOWAS Female Parliamentary Association. Ironically, the attack on the female politician came at a time when the world is commemorating 16 days of activism, the global campaign to challenge violence against women and girls. Reporting for QTV News from Abuja, Nigeria, I am Aliou Cisse.
Quite unfortunate. And also in international news, Africa could be moving closer to a win-win partnership with the USA, some analysts say, at the U.S.-Africa Leaders Summit in Washington, D.C., which kicked off today, Tuesday, 13th December. Jennifer Sonko has more.
The three-day summit will focus on key challenges including the climate crisis, good governance, food security and global health, as well as U.S.-Africa trade and investment opportunities. 49 African heads of state are in attendance, and officials of the African Union were also invited to the summit. The gathering marks the biggest international gathering in Washington, D.C. since before the start of the COVID-19 pandemic. The African Growth and Opportunity Act has been at the core of U.S. economic policy and commercial engagement with sub-Saharan Africa since 2000. It provides eligible countries in the region with duty-free access to U.S. markets for over 1,800 products. Analysts say this hasn't been beneficial and African leaders shouldn't attend the summit as beggars. One analyst say if there has not been as successful as it ought to have been because African governments have not seized the opportunities it provides. The program is due to end in 2025. Many analysts believe that the Africa Growth and Opportunity Act had been undertaken by developments in Africa, including the African Continental Free Trade Agreement, the largest of its kind in the world, which came into effect on January 1st, 2021. In addition, China's engagement and influence in Africa have grown and undertaken that of the United States. In addition, Russia's President Putin also organized a Russia-Africa summit in October 2019. The Biden administration will use the summit to rebuild Washington's relationship with African nations and organizations such as the United Nations after 4 years of Donald Trump's America First approach to foreign policy. It is clear this summit has been called to address America's influence in Africa at a time when China's and Russia's influence appear to be growing. At a media briefing last week, U.S. Deputy Assistant Secretary of Defense for African Affairs, Shidi Beliden, said that the U.S. would have to review its position on Africa and the kind of partnerships it can establish. The United States has committed $55 billion to Africa on the course of the next 3 years across a wide range of sectors to tackle challenges in the continent. Certain countries have not been invited to the summit. The White House named them as Burkina Faso, Mali, Guinea and Sudan, said they were excluded because the AU had suspended them over recent coups. Reporting for QTV News, I am Jennifer Sonko.
And that's all about it for this bulletin. But before we take a leave of you, here's a recap of our main headlines. The Presidential Meet the People tour wrapped up on Monday in Banjul, where the president renewed his commitment to bring more development projects to transform the Gambia. The program manager at the National Malaria Control Program has revealed that malaria prevalence in the Gambia is 0.1%. UNIDO has handed over a multi-million-dollar fish smoking house to the women fish smokers at the Brufut and Tangier fish landing sites. On Monday, the Gambia joined the rest of the world to commemorate Universal Health Coverage Day, to raise awareness of what is required to deliver essential health care. In international news, ECOWAS parliamentarians have strongly condemned the abuse of a female parliamentarian in Senegal's parliament, seen in a widely circulated video. That's all for this edition. Do join us at 10 p.m. for another bulletin. Thanks for watching.